What is the most feared complication in this condition? A 1-month-old infant presents to the emergency department with acute onset bilious vomiting and distended abdomen. The physician suspects intestinal malrotation and orders an upper GI series that confirms the diagnosis. Which of the following is the most feared complication in this condition? Intestinal malrotation, upper GI confirms the diagnosis. Okay. So really my thinking is like, what's just going to be the most dangerous to the baby? Meckel's diverticulum, I think, is not that big of a deal. So I'm going to say no to that. Pyloric stenosis to me is not related to what's happening here. So I'm going to say no to those last two. Intussusception is when you have like telescoping of the organs. I don't know what 100% this will be. Volvulus or Hirschsprung? Hirschsprung's disease to me is not caused by intestinal malrotation. That's caused by the neural crest cell lack of like travel. So I'm gonna say it can't be that. And between those two, I'd probably pick volvulus. I don't intussusception. I don't know. I'll probably go with volvulus. I could be wrong.
Yeah. No, Volvulus is good. So talk to me about what is malrotation?
It's literally just exactly that rotation that is bad for the. It's gonna be like things that are twisting upon inside themselves and causing maybe like an obstruction that could
Yeah.
lead to like an infection.
Yeah. So intestinal malformation, if you think about it, that's exactly what a volvulus is. A volvulus is this twisting of the bowel around its mesentery, right? That can lead to bowel obstruction, ischemia, necrosis, and perforation. Intussusception is telescoping, right? Just remember the risk factor for intussusception. Okay. Intussusception, right? You can have lymphoma, right? Some kind of GI issue, right? Mass, right? And so
Yeah,
those are your risk factors. Hirschsprung disease, you already mentioned it, right? Absence of ganglion cells of the distal colon leading to functional obstruction. It's not a complication of intestinal malrotation, right? Meckel's diverticulum is an outpouching of the ileum, right? This is usually painless, bloody stools, right? And remember, intussusception is painful bloody stools. They like to mention they like to always ask this against each other. So if you have painless bleeding in a pediatric kid in the GI tract, it's Meckel's diverticulum. If you have a painful acute bleeding, then it's intussusception. And then pyloric stenosis, right? It's usually going to be what, bilious or non-bilious?
non-bilious vomiting.
Non-bilious
Projectile vomiting, yeah.
projectile vomiting, exactly, right? And a lot of times on a physical exam, they always mention that you can palpate like an olive, right, in the stomach
Yep.
because that's the pylorus, like really, really thick, right?